Hello everyone, bonjour à tous. La dernière année.
The last year has been difficult, but what we have seen is that Canadians are there for each other. Throughout this long pandemic, we learned that we could count on our neighbors and on our loved ones. Whether you're shopping for someone in need or simply wearing a mask to protect your colleagues, I want to say thank you. It's by helping others around us that we will manage to get through this crisis.
Some people are still choosing to join large gatherings or even go out of their way to protest public health measures and disrupt vaccine appointments. But here's the thing. The reason so many Canadians are following public health measures isn't just because they want things to get back to normal. It's because they care about their neighbors and about our frontline workers. It's because they know people who are vulnerable, people who could die if this virus keeps spreading. These protests are supposed to be about getting back to normal, but by spreading the virus, they do just the opposite and prolong lockdowns. So follow public health advice, but don't do it for me or for any politician. Do it for someone in your life that you care about. Do it because you respect your fellow Canadians. To the millions of people who are already doing this and who are stepping up to look out for those around you, thank you. As you do your part, know that we have your back. Across the country, we're deploying additional support to provinces and territories that have been hit hardest by this third wave. For Alberta, we continued reaching out to the province through the weekend. We're offering whatever help they need to get the situation under control and keep Albertans safe. For the GTA, the second team of healthcare workers from Newfoundland and Labrador will arrive at Pearson this afternoon on board a Canadian Armed Forces airplane. They'll join the first team that's already there, as well as the Armed Forces members who are helping in Toronto hospitals. And for all Canadians, we continue to deliver PPE, rapid tests, and of course, vaccines. We have now delivered 16.8 million doses of COVID-19 vaccines to the provinces and territories. This week, just like every week in May, we're receiving 2 million doses from Pfizer alone. Already 1.3 million doses of this week's shipment have been delivered to the provinces and territories. For Moderna, we're picking up our next shipment tonight in Europe, and by tomorrow morning, 1 million Moderna doses will be on the ground in Canada. Almost all of these doses will arrive in provinces and territories by the end of the week.
In total, more than 3 million vaccine doses will be delivered this week. Every day, more and more people are being vaccinated. Every dose allows to protect another person. Every dose is a step towards the end of this pandemic.
All vaccines in Canada have been approved by Health Canada. Our advice to provinces and territories and to Canadians has not changed. Dr. Tam will have more to say in a few minutes, but make sure you get your shot as soon as it's your turn. Already we're seeing how vaccines, along with public health measures, keep people safe. We've administered hundreds of thousands of vaccine doses in hundreds of Indigenous communities. Cases are now falling quickly in places across the country. In fact, for First Nations communities alone, active cases are about a sixth of what they were at the end of January. This is not a coincidence. Vaccines work. From day one, our top priority has been keeping people safe. And as long as this crisis lasts, that remains job one. In Budget 2021, we laid out an additional $1.2 billion to finish the fight against COVID-19 for Indigenous communities. This will go towards everything from hiring nurses to getting PPE to the front lines.
In Budget 2021, we also plan to invest more than $500 million in a mental health and wellness strategy for First Nations, Inuit, and the Métis. Mental health is just as important as other aspects of our health. Everyone deserves the care and the support that they need. In fact, at the beginning of Mental Health Week, I want to remind everyone that if you are having any problems, you're not alone. Ask for help. You can always consult the Wellness Together Canada website, which offers 24/7 access to resources and support. You can create an account online, or you can call 1-866-585-0445. Once again, 1-866-585-0445. For Indigenous people, there is also the Hope for Wellness helpline, which offers help in several languages. To reach this line, call 1-855-242-3310 or visit Hope for Wellness telephone. Later on today, Minister Miller will be meeting with communities in Quebec to discuss the ways in which we can ensure that everyone has a chance to be successful, particularly in ensuring that our children receive a quality education that is adapted to their culture. The goal is to listen to what communities need and to see how we can continue to advance together on the path to reconciliation.
Access to clean water, just like everyone should have a safe home and a good job. Together, we've made progress in the past 5 years. On drinking water alone, we've lifted 106 long-term advisories since 2015. But if this pandemic has taught us anything, it's that there's always more work to do. That's why we're investing $6 billion for Indigenous infrastructure projects. Whether for roads or schools, this will close gaps that far too many people still face and support good jobs across the country. Together, we can and we will continue to move forward. En raison de cette pandémie,
Because of this pandemic, many people are depending more and more on wireless connections, whether it's for school, work, or to talk to their families. A cell package or Wi-Fi connection at home is not a luxury, it is a need. And this is something that everyone should be able to afford. In 2019, we promised to reduce costs for cell services by 25%, also for Wi-Fi. Today, we've seen the most recent reports on average costs for packages for home and internet, and prices have gone down between 9 and 28%. That's encouraging news. We are on the right path. As we rebuild following this pandemic, we will try to always make life more affordable for the middle class.
I want to recognize that May marks the start of both Asian Heritage Month and Canadian Jewish Heritage Month. As we celebrate the contributions of Asian Canadians and of the Jewish community alike, we have a lot to be thankful for. Because from dropping off groceries for neighbors to organizing PPE drives, in the last year, people have come together like never before. Truly, diversity is our strength, and it's something we must always stand up for. There is no place in Canada for anti-Semitism. There's no place for anti-Asian racism. There's no place for hatred or discrimination against anyone or any community. On est toujours.
We are always stronger together, today and every day. Thank you very much, and I will now give the floor to Minister Anand. Anita.
Thank you, Prime Minister. Today, I will provide you with an update on vaccine deliveries into this country. En date d'hier,
As of yesterday, more than 16.8 million doses of COVID-19 vaccines have arrived in Canada. To date, the provinces and territories have administered more than 14 million of those doses. Nearly 34% of Canadians have received at least one dose. Each and every day, we are increasing our collective protection and advancing further down the path that will lead us out of the pandemic.
phase of our vaccine campaign, our government has been keeping Canadians up to date on our plans and progress. And when Moderna informed us that there would be delays while they worked to ramp up production, we shared that news as soon as we received it. Today, I am pleased to provide some good news on that front. The 1 million Moderna doses, originally anticipated to be picked up next week, have now been picked up, and they are en route to Canada and scheduled to arrive early tomorrow morning. I can also tell you that Moderna has been working with our department at PSPC to solidify a more regular schedule going forward. This week's Moderna shipment, combined with the 2 million doses arriving from Pfizer, mean that a total of 3 million doses will be in Canada before the end of the week. And arrivals of the Pfizer vaccine continue to be on track for 2 million doses each week in May. That number ramps up to 2.4 million doses each week over 5 weeks in June. De plus en plus.
More and more Canadians from across the country are now booking their appointments, bringing relief and hope to so many. And it is extremely encouraging to see that such an enthusiastic uptake of vaccines among Canadians. Now that the provinces and territories have been expanding the administration of vaccines to younger age groups and priority populations, we have even more to look forward to this spring.
And all of our public health experts will tell you, we can't let down our guard. These next weeks and months are crucial as our vaccination campaign accelerates. We need to remain vigilant in our efforts to curb the spread of the virus and its more contagious variants. I would like to express my appreciation to all Canadians for observing the public health guidelines and keeping their own communities safe. Alors que les
As more vaccines arrive and more Canadians get their shot, please do your part and continue to follow these guidelines. For our government's part, we will continue our efforts to get vaccines into the country as quickly as possible. And we will not stop until every Canadian who wants a vaccine receives one.
Merci, Miigwech. And now I think Minister Miller.
Thank you, Minister Anand. Kwekwe unusakut, tanse, hello et bonjour. I'd like to begin by acknowledging that I am on the traditional territory of the Algonquin and Anishinaabe people. J'aimerais d'abord.
I'd like, first of all, to emphasize that this week is Mental Health Week. The COVID-19 pandemic has had deep repercussions on the mental health and well-being of Indigenous peoples, and it has emphasized existing inequalities in terms of healthcare and mental health care especially, and has created new needs.
Mental wellness is by talking about it. Speak out about it. Speak out about how you're feeling. Reach out to friends, families, and elders. And if you need help, there are people to support you. The Hope for Wellness line is there for everyone. First Nations, Inuit, Métis, children, youth, or adults. As the Prime Minister said, you can reach them by calling 1-855-242-3310, 1-855-242-3310, or connect to an online chat of hopeforwellness.ca. Telephone counseling is also available in Cree, Ojibwe, and Inuktitut. I'd like to give you an update on the case numbers and vaccines rollout in First Nations and Inuit communities. En date du 3 mai,
as of May 3rd, in First Nations communities on reserves, we are aware of 771 active cases, which brings us to a total of 25,000 and some cases of COVID-19. So 26,000 cases of recovery and tragically 390 some deaths. What we've seen in Quebec as of the 4th of May, the government of Nunavut is talking about 85 active cases.
Speaking with the government of Nunavut and Nunavut Tungavik Incorporated to provide significant financial support for food security and enhanced public health measures, among others. Indigenous communities are keeping up the fight against COVID-19. However, events in Iqaluit and alarming outbreaks in some communities are painful reminders to maintain public health measures. This is not over. Vaccinations remain our top defense against the virus. By prioritizing and vaccinating Indigenous communities first, we've managed to significantly decrease case counts and keep more Indigenous individuals healthy. As of April 30th, just shy of 370,000 doses have been administered in over 661 First Nations, Inuit, and territorial communities. Of that, 107,596 were second doses. That means that over 59% of adults in First Nations communities, as well as over 72% of adults living in the territories, have received at least one dose of the COVID-19 vaccine. In Inuit communities, this rate goes up to almost 80%, and the data is clear. The COVID-19 case rate has drastically slowed down as the number of vaccinated people increased. Il existe de nombreux exemples de
There are many successful examples as we roll out vaccines across the country. 585 First Nations communities have vaccination programs underway. In Quebec, it has happened in all communities. In Kahnawake, for example, they have wrapped up their vaccination campaign last week. And almost all of the elderly were vaccinated successfully.
Communities. And as of April 27th, 53% of the populations aged 18 and older living on reserve had received at least one dose of the COVID-19 vaccine at a rate that is over twice that of Alberta's. I'd also like to highlight the outstanding work done by the Blackfoot Confederacy in sharing vaccines to keep everyone safe. Despite the recent surge in cases in Alberta, active cases among First Nations in communities on reserve has totaled recently 223 active cases, and is encouraging to see the support and partnerships in the vaccine rollout. The Canadian Armed Forces also continue to assist vaccination teams with the accelerated pace of immunization in a number of on-reserve Indigenous communities in northern Manitoba, among others. CAF has also been assisting provincial vaccination authorities with tasks associated with vaccine administration in more than 25 communities in the Anishinaabe Nation in northern Ontario. This week in particular, CAF will be assisting in Wunumin and Piganjikum First Nation communities with the second dose of COVID-19. Miigwech, Nakumik, Marcy, thank you, et merci.
Dr. Tam?
Thank you very much. Bonjour à toutes.
Good morning to everyone.
The world reached an amazing milestone of over 1 billion vaccines administered. And today we'd like to give a shout out to the millions of Canadians who have been stepping up to get vaccinated, and the many among them who are actively helping others by sharing credible information and assisting in other ways. But first, the numbers update. To date, over 1.2 million cases of COVID-19, including over 24,300 deaths, have been reported in Canada. We are making progress nationally, but there are still a few tricky spots. The decline in national case counts has slowed to a less than 2% decrease over the past week, with an average of 7,900 cases reported daily. Unfortunately, the number of people experiencing severe and critical illness remains high. Over the past week, an average of almost 4,300 people with COVID-19 were being treated in our hospitals each day, including over 1,450 people being treated in intensive care units. At the same time, an average of 47 deaths were reported daily. Yesterday, the National Advisory Committee on Immunization updated its recommendations on the use of COVID-19 vaccines to include advice on the use of the Janssen COVID-19 vaccine. As with the AstraZeneca vaccine, there have been confirmed cases of very rare but serious blood clots associated with low levels of blood platelets, known as vaccine-induced immune thrombotic thrombocytopenia, or VIT, after administration of the Janssen vaccine. At this time, and based on current evidence, NACI recommends the Janssen vaccine may be offered to individuals 30 years of age and older without contraindications if the individual wants to receive a vaccine right away. The recommendations have been updated based on an assessment of the risk of VIT COVID-19 exposure risk, and the potential benefit of earlier vaccination in preventing serious COVID-19 disease for various age groups. Provinces and territories are currently planning to add this additional tool to their toolbox to help end the pandemic as soon as possible. As we move through this rough period, we can be optimistic as vaccine supply expands and more Canadians roll up a sleeve. There is a real sense of hope and solidarity in the air. Recently, a Canadian collaborative movement has popped up with a dedicated website and hashtag aimed at getting more Canadians informed and motivated to get their shots. This is ourshot.ca is rallying Canadians across the country to encourage each other to replace vaccine hesitancy with confidence so that we can end the pandemic together. They have partnered with task forces and doctors serving racialized and ethnic communities across Canada to address their questions and concerns by making information more accessible, including by offering resources in 28 different languages, from Amharic to Vietnamese. Initiatives like these can inspire all of us to join the challenge that will help spread the message that by getting vaccinated, we're taking action to end the COVID-19 pandemic in Canada. But let's not forget, there are also other things we all need to be doing to keep ourselves, our loved ones, and our communities safer. Regardless of our vaccination status, we all need to continue following public health advice and maintain individual wash, mask, space practices, even as we're beginning to see the positive impacts of COVID-19 vaccines. This is May the 4th, and during the month of May, Canada's vaccine supplies are expanding. So may the 4th of immunity be with you. Thank you.
Bonjour à toutes et à tous.
Good morning, everyone. Last week, the world reached an amazing milestone of over 1 billion vaccines administered. And today, we'd like to give a shout out to the millions of Canadians who have been stepping up to get vaccinated, and the many among them who actively helping others by sharing credible information and assisting in other ways. But first, the numbers update. To date, over 1.2 million cases of COVID-19, including over 24,300 deaths, have been reported in Canada. We are making progress nationally, but there are still a few tricky spots. The decline in national case counts has slowed to less than 2% decrease over the past week, with an average of 7,900 cases reported daily. Unfortunately, the number of people experiencing severe and critical illness remains high. Over the past week, an average of almost 4,300 people with COVID-19 were being treated in our hospitals each day, including over 1,450 people being treated in intensive care units. At the same time, an average of 47 deaths were reported daily. Yesterday, the National Advisory Committee on Immunization, or NACI, updated its recommendations on the use of COVID-19 vaccines to include advice on the use of the Janssen COVID-19 vaccine. As with the AstraZeneca vaccine, there have been confirmed cases of very rare but serious blood clots associated with low levels of blood platelets, known as vaccine-induced immune thrombocytopenia, or VIT, after administration of the Janssen vaccine. At this time, and based on current evidence, NACI recommends that the Janssen COVID-19 vaccine may be offered to individuals 30 years of age and older without contraindications if the individual wants to receive a vaccine right away. The recommendations have been updated based on an assessment of the risk of VIT, COVID-19 exposure risk, and the potential benefits of early vaccination in preventing serious COVID-19 disease for various age groups. Provinces and territories are planning to add this additional tool to their toolbox to help end the pandemic as soon as possible. As we move through this rough period, we can be optimistic. As vaccine supply expands and more Canadians roll up a sleeve, there is a real sense of hope and solidarity in the air. Recently, a Canadian collaborative movement has popped up with a dedicated website and hashtag aimed at getting more Canadians informed and motivated to get their shots. ThisIsOurShot.ca is rallying Canadians across the country to encourage each other to replace vaccine hesitancy with confidence so that we can end the pandemic together. They have partnered with task forces and doctors serving racialized and ethnic communities across Canada to address their questions and concerns by making information more accessible, including by offering resources in 28 different languages, from Amharic to Vietnamese. Initiatives like these can inspire all of us to join the challenge that will help spread the message that by getting vaccinated, we're taking action to end the COVID-19 pandemic in Canada. But let's not forget, there are also other things we all need to do to keep ourselves, our loved ones, and our communities safe. Regardless of our vaccination status, we all need to continue following public health advice and maintain individual wash, mask, space practices, even as we're beginning to see the positive impacts of COVID-19 vaccines. This May the 4th and during the month of May, Canada's vaccine supplies are expanding. May the 4th of immunity be with you. Thank you.
Thank you, Dr. Njoo. We'll now turn to questions on the phone. The Prime Minister will be around for a number of questions from the phone in the room, and then the ministers and doctors will still be available after that. Operator, over to you.
Thank you, merci. You may press star 1 if you have a question. Vous pouvez appuyer sur étoile 1 si vous avez une question. La première question de l'INADIB de la presse canadienne. La parole est à vous.
Oui, bonjour.
Good morning, Mr. Trudeau. I'd like to ask you about vaccine passports for international travel. I'd like to know if the American administration has said what they think of this. I know that they're not very fond of the idea of having passports, vaccine passports to go to restaurants, et cetera. But what do you know what they think about this for international travel? And have they shared that with you? Thank you, Lena, the answer. First of all, let me reiterate that this is not the time to travel. We haven't reached that point yet. We're hoping to get to that in the coming months, but for the moment, we need to limit our movements and follow public health guidelines and instructions. We have to be vaccinated as quickly as possible. Every country in the world can put forward principles or expectations that they have so that people may be able to travel there. Some countries require vaccinations for yellow fever and cholera or other illnesses. But for us and European countries as well, we're looking at the question of vaccine certificates as to whether they'd be useful or necessary in order to travel once we are through the pandemic. Obviously, every country will take its own decisions, but we are interested in aligning with the countries that would like to do so, because we know that ensuring the protection of Canadians must be our primary concern. But I can't speak for the United States and the decisions that they may be taking in terms of people visiting their country. So you say you can't speak for the States. Well, just a moment. I just repeat it in English.
Let me begin by saying, first of all, that now is not the time to travel. We are all hopeful we're going to be able to get back to normal in the coming months and start traveling again. But the reality is we're not there yet. We're still very much in a third wave. We still need to get more and more people vaccinated across this country and get those numbers down. However, we also know that as people start to travel again, perhaps this summer, if everything goes well, it would make sense for us to align with partners around the world on some sort of proof of vaccination or vaccine certification. We are now working with allies, particularly in Europe, on that. But ultimately, it is up to every country to determine what requirements they expect from incoming travelers. We are looking very carefully at it, hoping to align with allied countries. but I can't speak for the United States and the choices they might make around who to welcome into their country.
Suivi,
Oui, merci.
Thank you. You say that you cannot speak for the states, but there are neighbors, and the most travel is between our two countries. So are you saying that Canada may require a proof of vaccination from Americans as they cross the border when the Americans are not going to necessarily require one of us? Answer. Well, we have seen from the outset that we are trying to align ourselves with our partners, particularly the United States. That's what we've done with the land border from the outset. And ideally speaking, we would have similar measures. But our responsibility is to do everything necessary to protect Canadians. And we are going to do that, even if there isn't automatically symmetry with other countries. We will continue to make that our absolute priority, the protection of people in our country. Thank you.
Thank you, merci. The next question is from Charlie Pinkerton from iPolitics. Please go ahead.
Good afternoon. Prime Minister, tomorrow at a meeting of the World Trade Organization's General Council, a month-old request from India and South Africa to waive some patent protections to allow poorer countries easier access to COVID-19 vaccines will again be discussed. Would Canada vote in favor of this waiver, should it come to it?
Canada well understands, Charlie, that this pandemic isn't over anywhere until it's over everywhere. And that's why at the WTO, with the WHO, with various partners around the world, we continue to work to ensure, including through COVAX and the ACT Accelerator, that there are vaccines available for people all around the world as quickly and in as large quantities as possible. I know the conversations around patent protections are ongoing, and Canada is actively participating in them, but we understand how important it is to get vaccines to the most vulnerable around the world, and we will keep working for that.
a follow-up, Charlie?
Yeah, I would appreciate a more firm answer on whether or not Canada would support this, but I suppose a follow-up question would be, would vaccine passports be something that your government would be willing to create ahead of the time that everyone has access to vaccines? So before the time that everyone's had a chance to get 2 shots?
As I've said, every step of the way, we're going to make sure we're doing everything we can to keep Canadians safe. And that means following science, listening to experts on recommendations they're making. We know that vaccination is a really important part of how we get through this for the long term. And that is going to be something we're continuing Canadians to do. We need to make sure that access is equitable. We're happy to be highlighting today the tremendously successful vaccination campaigns that have been taking place in Indigenous communities across the country with full partnership of Indigenous leadership. These are the kinds of things we need to make sure that we're doing so that any steps we take moving forward are fair for everyone. But yes, as I said, we are looking at requirements around vaccination on international travel, and we will, as much as possible, align with partners and allies on these issues.
Thank you, and we'll take one more question on the phone. Operator?
The next question is from Ryan Tumilty from the National Post. Please go ahead.
Yeah, good morning, sir. I'm sure you know NACI yesterday recommended that people who can wait for an mRNA vaccine should pass on the Johnson & Johnson vaccine or the AstraZeneca vaccine because of the risk of blood clots. I'm wondering if you're concerned that that recommendation is going to slow Canada's vaccine rollout and further muddle the waters and create more vaccine hesitancy.
I think first and foremost, Ryan, I have heard, and you have heard, and we have all heard directly from friends, loved ones, Canadians in general, how eager everyone is to get through this, get back to normal, get to a better summer, end this pandemic once and for all. Everyone wants that, and we know the way to do that is to get as many people vaccinated as quickly as possible. The longer we wait, the longer it takes, the slower before we get back to normal, the slower before we get to drive down case numbers across the country. So everyone knows that we need to get our shots as quickly as possible. And I can reinforce once again that every single vaccine available in Canada has been approved by Health Canada as being both safe and effective. It is a good thing that we get to hear from a broad range of medical experts and doctors making recommendations to keep us safe. The bottom line is we need to, all of us, get vaccinated as quickly as possible so we can get back to normal. But I will turn to Dr. Tam for a follow-up on the medical aspects of that question. Theresa.
Yes, thank you for that question. And I think that Canadians should feel confident in so many ways about getting vaccinated. As the Prime Minister said, this is the key to help us get through this pandemic, is to get vaccinated. I think that it is hard for people to understand evolving science and evolving data. That's what's been so difficult for so many people throughout this pandemic. But I think I am very heartened that the National Advisory Committee on Immunization is taking the data that we're gathering in real time into account and evolving the advice based on that. We all want transparency. We all want that the data is carefully analyzed as we're going along. That doesn't make it easy for people to understand, but I think that that's a really important principle, and that as benefits and risks are weighed, these parameters could shift over time, and we can depend on NACI and our Chief Medical Officers Health across Canada to take all of that into account as they provide vaccines to everyone. We will keep learning as we go and incorporate any surveillance information, for example, that we have on serious adverse events. And NACI, I think what I heard from the Chief Medical Officers is that they are very grateful for NACI for providing them with the risk-benefit framework upon which they will incorporate the viral vector vaccines such as AstraZeneca and Janssen. And they will serve the population with the best advice as they're rolling out their implementation program. But I think that we all have to understand that everyone is trying to provide the best information in order for everyone to make a decision. What I've also heard from Chief Medical Officers is that there is no doubt in their minds, as they're experiencing a very significant resurgence in COVID-19 and seeing ICUs filled up and seeing deaths still occurring across the country, that the AstraZeneca vaccine has really saved lives, and that the vaccine has done what it was designed to do. And that the longer you wait to get vaccinated, the longer that you're not protected. Having said that, they too will take advice from NACI and others and evolve not only as our data evolves on the benefit and risk, but also adapting and calibrating as our supplies, for example, the mRNA vaccine, rapidly escalates over time. So I think that Canadians should be confident that our public health systems are providing you with the best advice and the vaccines as they become available.
C'est important just une seconde, Ryan.
Just a moment, Ryan, I'm going to answer in English. I think all Canadians are anxious to be done with this pandemic. And I think that everyone understands well that vaccination is a critical step in seeing the end of this crisis. Everyone has to be vaccinated as quickly as possible using all the means that we have. But I want to repeat what people know, which is that Health Canada has approved every vaccine that's being used in Canada as being safe and effective. We will always listen to the experts and scientists who make these recommendations to us, but the important thing is to get vaccinated as quickly as possible in the full knowledge that these vaccines are safe and effective, all of them.
Follow up, Ryan?
Yeah, sir. Right now, Canadians are hearing from NACI, they're hearing from you, they're hearing from Health Canada, and they're hearing from local medical offices of health, and often they're hearing different advice. I'm wondering if you think, in retrospect, the government should have clarified the communications process so that Canadians aren't getting confused and potentially more vaccine hesitant in the middle of this pandemic.
As we've pointed out many times, Canada is a big country with very different realities in terms of pandemic, in terms of demographics, right across the country. And every step of the way, we have put out federal recommendations, but also made sure that the provincial authorities, the people closest to the ground, the people understanding the situation and the way forward best, are able to make their recommendations. We also have seen evolving science. These vaccines were developed to be safe and effective in record time, and that is saving millions of lives around the world. But also because of that, the data continues to roll in. And there's always opportunities to refine or adjust those recommendations. And that's why we're pleased to be able to continue to count on an extraordinary team of experts and doctors. Je pense que c'est important.
I think that it's important to emphasize that the pandemic is not the same in different areas of the country. And yes, we are continuing to send out messages from the federal government level, but we also see that we need to have experts in the various provinces and territories to share what is most appropriate for their citizens. There are geographical variations and demographic variations, and we always have to have confidence in local authorities. That is why we continue to work together. And the underlying principle is that, yes, we are going to monitor this and assess as the situation evolves and as new facts become available to us. But we will always put the safety of Canadians at the forefront as a priority.
Mr. Michael Couture with Global National. I just wanted to come back on NACI sort of doubling down on this idea of preferred vaccines. As one of the 1.7 million Canadians who got one of the not preferred vaccines, I wanted to know, what do you think of that, first of all? And second of all, we're hearing from doctors that are saying that what NACI is doing right now is actually dangerous because it's going against public health guidelines. Do you think that NACI still really serves a purpose here?
First of all, let me remind everyone that every vaccine administered in Canada is safe and effective as evaluated by Health Canada. The safety of Canadians is first and foremost. And we have seen the tragic impacts of COVID-19 all across the country, and vaccines are one of the key tools to reduce the deaths and the vulnerability of Canadians to COVID-19. That's why we are continuing to recommend to everyone to get vaccinated as quickly as possible, so we can get through this, so we can see case numbers drive down, and we can end with so many of these restrictions. I am very, very happy that I got my shot, and I'm encouraging everyone to get vaccinated because that's what Health Canada and all experts are highlighting is necessary to get through this.
Sorry, I got to follow. I just wanted to ask you, last week, you talked about your Chief of Staff, Katie Telford, as a strong leader when it comes to fighting accusations of misconduct in the military. You said it's because of her leadership that you call yourselves a feminist government. So why does it seem like the Liberals at the National Defense Committee are trying to prevent her from testifying? And would you be okay with her testifying?
It is unfortunate, but not surprising, to see Conservatives playing extremely aggressive partisan games with this issue. My focus, our focus as a government, our focus as a country needs to be on supporting survivors of sexual assault and harassment and recognizing that the systems that have been in place for many years in the military and elsewhere have not given people comfort to come forward, share their stories, and demand consequences. That is a failing that we have collectively had, particularly in the armed forces, and it's something that needs to end. We have taken significant measures over the past number of years, but as we've clearly seen, there is much more to do. And that's why we made announcements last week with Justice Louise Arbour and General Carignan to put in place measures that will make sure that anyone who experiences harassment, assault in the military or anywhere else for that matter in this country has ways to come forward, engage in a process, be supported, and know that we are serious about putting an end to the unacceptable culture that has tolerated this for far too long in our military and in other institutions. Je pense que c'est désolant de voir.
I think it's so unfortunate to see the Conservative Party playing political games with this issue. We all should be focused on this, and this is what my government and I myself am concentrating on, is to put an end to this culture that accepts harassment and sexual assault in the armed forces and elsewhere. The reality is that too many people who have undergone these unacceptable experiences do not feel supported and don't have the resources and the ability to demand consequences and to share their stories. Yes, we have made improvements over the last few years, but it's not enough. And that is why we announced Madam Justice Arbour and General Carignan's work to set up better support measures for anyone who would have suffered unacceptable behavior. We must ensure that the men and women who serve in our armed forces are protected in this country.
Prime Minister, you've repeatedly come here in this very room and said that the best vaccine to take is the first one offered to you. Based on that advice, 1.7 million Canadians went and got the AstraZeneca shot. Now they learn that that is not necessarily true from your science advisors, that some of them should have waited to take Moderna or Pfizer. Do you understand how frustrated they are by that? What do you say to them? And what do you say to someone who's got an appointment today to take AstraZeneca and is now maybe thinking that isn't the right vaccine for them?
On a personal level, I am extremely pleased that I got the AstraZeneca vaccine a number of weeks ago. It was extremely important to me to be able to protect my loved ones, to protect my family, and to do my part to ensure that all Canadians get through this as quickly as possible. And that's the reality. We all want to get through this pandemic as quickly as possible, and that means all of us getting vaccinated as quickly as possible. That is the focus that we have right now. And again, every single vaccine administered in Canada has been judged by Health Canada as being safe and effective. The impacts of catching COVID are far greater and far deadlier, as we've seen across the country, than potential side effects, which, although serious, are rare. But I'm not going to get too much into the medical advice, and I'm happy to turn it over to Dr. Tam for that. But the reality is, the way we get through this pandemic is to get vaccinated with whatever vaccine is offered to us as quickly as possible. Theresa.
Yes, as I've said, that I can certainly understand why some individuals are concerned or getting frustrated as advice appears to be evolving. But that is the nature of science and advice. And I think that Health Canada, as the Prime Minister said, is doing their job. They just put out, for example, a notice that they are taking a very diligent look at all the information about the Janssen vaccine before they release this vaccine for use in the population. So we know that they're doing their job. The National Advisory Committee on Immunization is also doing their job. So while overall benefits and risks are such that benefits might outweigh the risks, there are differences in how you look at benefits and risks depending on the disease activity within your jurisdiction or your local community, as well as your own risk in terms of your age or your risk factors. And the local public health department also takes into account the supply and logistic and other operational elements. But I think the bottom line is that everyone should be reassured that the regulator, the experts, and local medical officers of health have all done their work in a synchronized manner to provide the vaccines to the communities, so that you should trust that the vaccine program being offered to you is done with that best knowledge, and that information should be provided to everyone to make sure you get the best informed decisions. On AstraZeneca, on Janssen, we will continue to be monitoring the evolution in information. I think for those who received the AstraZeneca vaccine, as I've said, in the time frame that we're looking at, all medical officers have said it's been a really, really effective vaccine that saved lives. And I expect the National Advisory Committee on Immunization and the Chief Medical Officers will also look at what is the best advice going forward for those who already received a AstraZeneca vaccine, including any international evolving clinical trials and any domestic expert analysis on that second dose. So I just want to assure everyone that that advice will be forthcoming in time for when people need that second dose. But again, I reiterate from all chief medical officers that the AstraZeneca vaccine deployed in the middle of a third wave has saved lives and prevented serious illnesses.
Hi, Prime Minister. Tom Perry, CBC. I'd like to ask you about international travelers coming into Canada. By air, they're being funneled into 4 airports. They're supposed to quarantine when they land. Some of them aren't, though. They're taking a fine instead. When we asked PHAC how many people are taking fines, they said it's a number above 500, but they couldn't give us an exact number. Also, it seems that travelers arriving in Vancouver and Toronto are getting fined. Travelers arriving in Calgary and Montreal are just walking away without getting fined. So why is it your officials don't seem to know exactly how many people are opting out of quarantine? Why is it travelers at some airports are being fined and others not? And what are you going to do about that?
Thank you, Tom. First of all, let me remind people that when someone arrives in Canada, whether it's through an airport or through a land border, they have to show a 3-day PCR test that is negative. They have to get tested on arrival. They have to get tested again a week into their quarantine, and they do have to quarantine for 2 weeks at home. And that is for everyone arriving. On top of that, if you're arriving at an airport, you need to do a mandatory government-approved accommodation while waiting for the result of your on-arrival PCR test. These are all ways of putting in multiple levels and multiple layers to keep Canadians safe from arrivals of virus in this country, and allow us to study and follow up on the statistics, on the sequencing, on the reality of where those challenges are. And for example, the system clearly showed that in the case of flights from India and Pakistan, there was a higher level of importation of people testing positive on the on-arrival test. And that's why, based on that data, we were able to shift our posture and suspend those direct flights. When it comes to enforcement, the federal government works hand in hand with local authorities. The local police have jurisdiction, and we've seen that both in Vancouver and in Toronto, or in Ontario and BC, the cooperation between the federal government and the local police has been seamless, and we've been able to both collect data and follow up on this. In other jurisdictions, the arrangements are slightly different with both Quebec and Alberta. That means we don't have the same access to the data of the local enforcement actions. But like I said, yes, the RCMP and PHAC and others make follow-up calls and are part of the checking and enforcement of the mandatory 2-week quarantine. But local, municipal, and provincial police are also part of that equation and have the full authorities to bring in fines. And we certainly hope that there will be a greater access to data that can reassure people that those fines are indeed being applied and enforced everywhere across the country. Je pense que c'est important de souligner.
I think it's important to emphasize that travelers arriving in Canada have to do a test before boarding the plane to demonstrate that they're negative upon arrival. They have to be tested upon arrival as well, and then do another test a week later, and they must do those 2 weeks of quarantine. For those arriving by air, they have to wait in an approved hotel by the government until their arrival test comes back negative. We put these measures into place. There are several layers here, not only to prevent the variants arriving in Canada in great numbers, but also in order to be able to collect data to better understand what is happening and where the challenges are. For example, what we did with the suspension of flights arriving from India and Pakistan was based on the fact that among the arrival tests, there was a much higher number of positive cases, and therefore we were able to take action. In British Columbia and in Ontario, we are working very closely with local authorities, and we have the data on the penalties that have been handed out. But in Alberta and Quebec, we don't have the same data. We don't have the same partnership, but I know that local authorities and police have all the necessary powers to follow up on this and go after the people who are not obeying the quarantine orders, and there will be consequences.
Sexual assault victims and advocates have complained that Liberal MPs have treated them rudely at committee meetings. Will you speak to your caucus about their behavior in committee meetings, and do you think that the rules need to be reformed to take a more trauma-informed approach?
I think it's important for everyone to take a more trauma-informed approach on dealing with questions of sexual assault and sexual harassment, on providing support for survivors. Our institutions in general, whether it be the Canadian Armed Forces or our Parliament or workplaces across the country, need to do a better job of creating a supportive environment in which people who have experienced unacceptable actions are able to come forward and engage in a process that is going to support them and get consequences for inappropriate actions, and even further create environments in which those inappropriate actions don't happen in the first place. We all have to do better. We all need to take this seriously. And I know it's something that Liberal MPs, like all MPs, want to do a better job of. Every single party seems preoccupied with supporting survivors and making sure that we are improving our systems throughout government. And I can assure you that the Liberal government will continue to do just that.
Bonjour, Monsieur Trudeau, Juliane Lapointe.
Hello, Mr. Trudeau. Learning that Netflix will be exempted from taxes on their services, do you find that fair? And how do you justify that compared to other digital service providers? Answer. Well, we are in a global economy that has greatly changed over the last few years with the arrival of the web giants, particularly who don't pay their fair share of taxes. Every country, like Canada, has made promises to tax these web giants as of January 1, 2022. But our preference would be not to proceed alone, but to align ourselves with other countries in the world so that we have a coordinated and harmonized approach. The OECD is currently looking into the details of how to do this, and we will align ourselves ideally with what our international partners are doing. We promised to ensure that the sales tax should apply on subscriptions to Netflix, as we promised in 2019. And we also promised that Amazon, Google, Facebook, and Apple should pay their fair share of taxes to Canada for the services offered here. We're currently working on that. This is not a simple or easy issue, but if we are in alignment with the rest of the world, we will improve the responsibility of these companies to contribute to society and to people's lives, and as they make fantastic profits.
Recognize that the world is changing, and the presence of online giants that haven't paid their fair share of taxes in the countries where they are operating is something that needs to end. That's why we made a commitment to do just that, to bring in a taxation regime for web giants as of January 1st, 2022, on our own if necessary, but ideally in alignment with other like-minded countries. The OECD is working very hard on creating that alignment so that we're able to move forward, and we will ideally harmonize with what the rest of the world is doing to make sure that everyone is paying their fair share. We are moving forward with applying sales tax to Netflix subscriptions to be fair to streaming services that are Canadian. But at the same time, we will continue to look for ways to make sure that companies that are making tremendous profits off of Canadians without paying their fair share of taxes are actually held to account, and that's something we're moving forward on.
Thank you. That concludes the time that the Prime Minister has for questions. The ministers and doctors will be around for a few more moments afterwards for questions. We'll get started once the Prime Minister exits.